1. Which of the following arteries is most commonly evaluated during an ankle brachial index (ABI) examination? A. Radial artery. B. Posterior tibial artery. C. Brachial artery. D. Popliteal artery. 2. Which Doppler angle is considered optimal for vascular velocity measurements in ultrasound? A. 0 degrees. B. 45 degrees. C. 60 degrees. D. 90 degrees. 3. What is the primary advantage of using color Doppler in vascular ultrasound? A. Measures exact blood pressure. B. Visualizes the lumen of the vessel. C. Detects presence and direction of flow. D. Identifies vessel wall thickness. Or, which vessel provides the majority of blood flow to the brain? A. External carotid artery. B. Vertebral artery. C. Common carotid artery. D. Internal carotid artery. 5. A tardus parvus waveform is most indicative of which condition? A. Distal vasospasm. B. Proximal arterial stenosis. C. Venous insufficiency. D. Collateral circulation. 6. Which of the following describes physicity in venous flow? A. Flow varies with respiration. B. Flow is continuous without change. C. Flow increases during diastole. D. Flow demonstrates turbulence. 7. What is the normal ankle brachial index ABI range in a healthy patient? A. 0.2 to 0.4. B. 0.5 to 0.7. C. 0.9 to 1.3. D. 1.5 to 2.0. 8. What does spectral broadening on Doppler typically indicate? A. Normal laminar flow. B. Turbulent flow due to stenosis. C. Absence of flow. D. Venous reflux. 9. Which of the following veins is part of the deep venous system of the leg? A. Small saphenous vein. B. Great saphenous vein. C. Posterior tibial vein. D. Cephalic vein. 10. Which of the following is a limitation of plethysmography? A. Invasive nature of the test. B. Inability to evaluate vessel patency. C. Poor patient compliance. D. High radiation dose. 11. What is the typical cause of venous reflux in the lower extremities? A. Incompetent venous valves. B. Proximal arterial stenosis. C. Aneurysmal dilation. D. Arteriovenous fistula. 12. What is the primary role of perforator veins? A. Transport blood from deep to superficial veins. Transport blood from superficial to deep veins. C. Store blood during inactivity. D. Control arterial pressure. 13. Which ultrasound frequency is most suitable for imaging superficial arteries and veins? A. 2 MHz. B. 5 MHz. C. 7 to 10 MHz. D. 1 MHz. 14. Which type of transducer is most commonly used in vascular sonography? A. Linear array. B. Curvilinear array. C. Phased array. D. Sector array. 15. Which lower extremity artery is a continuation of the femoral artery? A. Popliteal artery. B. Posterior tibial artery. C. Dorsalis pedis artery. D. Perineal artery. 16. Which waveform pattern is expected in a normal peripheral artery? A. Monophasic. B. Biphasic or triphasic. C. Continuous. D. Reverse flow only. 17. What is the most common location for atherosclerotic plaque formation in the carotid artery? A. Distal internal carotid. B. External carotid origin. C. Carotid bulb and bifurcation. D. Proximal common carotid. 18. Which test is most accurate for detecting deep vein thrombosis, DVT? A. Venography. B. CT scan. C. Duplex ultrasound. D. Plethysmography. 19. Which Doppler shift is produced when blood flow moves toward the transducer? A. Negative shift. B. Positive shift. C. No shift. D. Randomized shift. 20. Which of the following is the gold standard invasive test for peripheral arterial disease, PAD? A. CT angiography. B. MR angiography. C. Digital subtraction angiography. D. Duplex sonography. 21. A reversed vertebral artery flow is most commonly associated with A. Subclavian steal syndrome. B. Carotid artery dissection. C. Vertebral artery aneurysm. D. Thoracic outlet syndrome. 22. Which parameter is essential in calculating volume flow rate? A vessel circumference. B. Vessel diameter. C. Blood viscosity. D. Heart rate. 23. Which artery supplies the lateral aspect of the leg and foot? A. Perineal artery. B. Anterior tibial artery. C. Posterior tibial artery. D. Popliteal artery. 24. What is the most common complication of untreated DVT? A. Varicose veins. B. Pulmonary embolism. C. Venous reflux. D. Lymphedema. 25. Which waveform change suggests greater than 70% stenosis in the internal carotid artery? A. Low resistance waveform. B. End diastolic velocity greater than 100 centimeters per second. C. Peak systolic velocity greater than 125 centimeters per second. D. Absence of color filling. 26. The cephalic vein drains into which vein? A. Subclavian vein. B. Axillary vein. C. Basilic vein. D. Brachial vein. 27. What is the most common sign of acute DVT on ultrasound? A. Compressible vein. B. Vein filled with echogenic material and non-compressible. C. Strong color filling. D. Increased respiratory physicity. 28. Which vessel carries the majority of venous return from the brain? A. External jugular vein. B. Vertebral vein. C. Internal jugular vein. D. Subclavian vein. 29. Which imaging modality provides the highest spatial resolution for vascular wall imaging? A. MRI. B. CT angiography. C. Intravascular ultrasound, IVUS. D. Duplex ultrasound. 30. Which physiologic test is most useful in diagnosing arterial insufficiency at rest and after exercise? A. Segmental limb pressures. E. Plethysmography. C. Arteriography. D. ABI testing. 31. Which artery supplies the dorsalis pedis pulse? A. Posterior tibial artery. B. Peroneal artery. C. Anterior tibial artery. D. Femoral artery. 32. Which of the following is not a risk factor for deep vein thrombosis? A. Prolonged immobilization. B. Pregnancy. C. Hypercoagulable states. D. Increased hydration. 33. Which of the following is the most common cause of renal artery stenosis? A. Fibromuscular dysplasia. B. Aneurysm. C. Atherosclerosis. D. Dissection. 34. Which lower extremity vein is most commonly affected by varicosities? A. Posterior tibial vein. B. Peroneal vein. C. Great saphenous vein. D. Small saphenous vein. 35. Which carotid artery Doppler finding suggests total occlusion? A. Peak systolic velocity of 200 centimeters per second. B. No detectable color flow or Doppler signal. C. Tardis parvis waveform. D. Turbulent flow pattern. 36. Which vein is commonly harvested for coronary artery bypass grafting? A. Basilic vein. B. Great saphenous vein. C. Cephalic vein. D. Small saphenous vein. 37. The subclavian artery originates from which vessel on the left side? A. Aortic arch. B. Brachiocephalic artery. C. Common carotid artery. D. External carotid artery. 38. Which Doppler principle explains the frequency shift related to blood velocity? A. Snell's law. B. Nyquist criterion. C. Doppler effect. D. Bernoulli principle. 39. Which venous condition is characterized by leg swelling, pain, and skin changes? A. Venous insufficiency. B. Lymphedema. C. Arterial occlusion. D. Aneurysm. 40. Which of the following is a direct method to evaluate venous reflux? A. Patient history. B. Compression maneuvers with Doppler. C. Plethysmography only. D. Visual inspection.